Assalamu alaikum viewers. The topic of my today discussion is parathyroid diseases. The diseases of parathyroid are divided into states. The first state is when parathyroid is overactive, and this condition is known as hyperparathyroidism. And the condition or state when parathyroid is under or hypoactive. This state is known as hypoparathyroidism. First, I will discuss about hyperparathyroidism. The hyperparathyroidism is further divided into three situations: primary situation, secondary situation, and tertiary state or situation. In the primary situation, it is the condition in which proliferation of chief cell take place. Due to proliferation of chief cells, amount of parathyroid hormone is increases. Increased amount of parathyroid hormone results in bone pain and retardness. Bone pain and retardness is due to calcium reabsorption. Secondary condition of hyperparathyroidism is related to renal diseases. Renal diseases lead to hyperparathyroidism. In secondary hyperparathyroidism, too much calcium is lost and it results in increased release of parathyroid hormone. It is also known as gland hypertrophy, and it results into more parathyroid hormones. In tertiary parahyperthyroidism, parathyroid hormone is unresponsive to blood calcium, and this results in increased release of parathyroid hormone. The hyperthyroidism can be treated by removal of abnormal parathyroid gland. When we remove surgically the abnormal parathyroid gland, then the hyperthyroidism can be treated. The second state of parathyroid is hypoparathyroidism. The state of decreased parathyroid activity is known as hypoparathyroidism. It is caused due to damage of gland and its blood supply. During surgery, the hypoparathyroidism is associated with dysgeorgic syndrome. If an individual tissue becomes resistant to parathyroid hormone, this results in hyperactivity of parathyroid gland, but parathyroid hormone do not perform function. In this case, calcium level decreases, and this condition is known as pseudo hypoparathyroidism. And this condition relates to Albright hereditary osteodystrophy. The hypoparathyroidism can be treated with vitamin D analogues. Thank you so much, viewers, and Allah Hafiz. Do not forget to subscribe my channel for latest and more relevant videos. Thank you.